And what would, so let's say I decide I want to be a nurse.
Mm-hmm.
What's my first step?
Nursing has a number of different pathways. It's one of the more confusing professions, actually, and there are many different levels. So a student who doesn't want to spend an enormous amount of time in school can choose to enter a certificate program at a vocational or technical school. And they can become certified as a home health attendant or certified nursing assistant. If a student wants to pursue something a little further, they can actually attend a community college and receive an associate's degree in nursing. There's also degrees offered at the baccalaureate level, master's level, and doctoral level. So it's really a varied career path. Students can enter the field from other professions, but there are serious shortages and great opportunities in that field.
Fair enough. And then let's say I'm interested in public health. What would be my path for that?
Public health is also another great field because it focuses on prevention and the study of populations. So there are lots of current events nowadays that are occurring that relate to public health, such as the swine flu or some other epidemic diseases. And the majority of training programs for public health are at the master's level. However, there are some newly created programs at the undergraduate level, basically as an introduction to public health. But most often you have to obtain a master's degree.
Fair enough. And in terms of public health, Dr. Haywood, I mean, do public health officials interact in some way officially with people at George Washington?
Absolutely. We have a School of Public Health, which is actually housed in the same building where the School of Medicine and Health Sciences is. And our public health students work very closely with the medical students. And public health is part of our curriculum, and I would dare say the part of the curriculum in every medical school in this country, because as has been said, prevention is the #1 topic. We need to figure out ways of enhancing prevention in order to make progress in disease.
Fair enough. And so let's assume that I'm concerned about prevention, okay? And I decide I'm interested in a career in public health. Would I ever go overseas? Because if you think about the big, if I understand this correctly, the last big public health crisis started in Mexico City. And from where I'm sitting, that was amazing that they were able to pinpoint that so quickly. So can one do that background work in Mexico or somewhere else, or does it just have to be in the United States?
There are numerous opportunities for students to do programs abroad. The National Institutes of Health has some great programs for students who want to work in third world countries, in Europe and Asia. It's a great opportunity, and many of those students spend either several weeks or a year studying abroad and gaining experience in that field.
And you recommend that?
Most definitely I do.
And Doctor, you would recommend that as well?
Absolutely. Many of our medical students in their final year of training spend time abroad, a month or 2-month rotations where they visit countries all over the world. We actually have a track program, and global health is one of our specific areas of interest for our students. And those students are required to spend time abroad.
And would they spend more than a few months perhaps, or?
Most of them would spend 2 months maximum, although if a student were particularly interested and had a very focused and well-run interest, we would certainly allow them to spend more time.
Right, and let's assume that I wanted to get a degree in public health, and I wanted to get,
Absolutely.
So I could do that at George Washington?
Yes, we have a program for medical students where they can actually obtain a dual degree.
A dual degree. And you would recommend that as well, Henryne, a dual degree?
Most definitely. Students, depending on the nature of the program and the structure, students can actually take a year off after their second year in medical school and go and obtain a master's in public health, or they can finish their 4 years of medical school and then go and get an MPH. It depends on what their needs are, but the dental profession also lends itself to obtaining a public health degree as well.
And if I were going to, let's say, go to Romania, right? I wanted to go to Romania, and I was interested in the health of Romania. How would I exactly do that?
Well, I guess you would do some research on the internet.
Fair enough.
And learn as much about the culture and the people. I mean, part of practicing care is also being culturally competent. So it would be really important to know what their customs and traditions are, their philosophy about medicine, and sort of their history as well.
Which gets to the issue that I was going to ask you before that I forgot to ask you, was the issue of, different parts of the world, different people look at medicine in different ways. And in fact, my students often will have a very distinct view of the MD degree versus the DO degree. And I was wondering if maybe both of you could speak to that issue about how we look at different medical degrees and how we look at the focus on medical training.
I would say that in the past there's probably been some bias for MDs and against DOs, and the notion that it's much more difficult to obtain an MD, but I think that's really in the past. I think both degrees are valuable, and that there is little, if any, distinction in the curriculum of medical schools and DO schools at this point.
And do you share that view? Or?
I agree. I think the great thing about Explore Health Careers is we're very careful not to provide biased information. It's really about giving information that provides informed decisions. So we don't make any determination about whether a DO or an MD is preferable or better. All of the health careers are equally are good and really important professions to enter.
Would you, just for our audience, maybe say a word or two about what the difference is between a DO and an MD traditionally?
As has been said, it's traditionally the same education, 4 years of medical school. They have to do the same residency, so they're actually competing for the same residency slots. Most people don't think about that. But at the 4-year medical school level, I think there's one important distinction, and that's manipulation, where they learn how to heal the body through the hands. But basically, outside of that, they look at a holistic viewpoint, and they may incorporate some alternative complementary medicine techniques as well. But essentially, really, they are partners in the healthcare team.
Complementary and alternative medicine has been also integrated into many, many medical schools. And in fact, that's another one of our tracks that our students are very interested in. So I think the distinctions are really starting to be, the lines are blurred.
But as a patient, let's say, does a patient ever come in and say, well, I have a preference for someone who's more holistic than less holistic?
I think every patient wants a holistic person to take care of them. I've never heard a patient say that, but I think our goal is certainly to train physicians who are holistic in their approach to the patient. I don't see that as a primary difference between DOs and MDs. I think the manipulation is a difference, but there's not a difference in terms of, I think both want to be holistic.
And if I was a medical student at your medical school at George Washington, how would I be rewarded for doing well?
Well, there are several honor societies. The first and probably most well known is the Alpha Omega Alpha Medical Honor Society. The top 16% of the class in terms of academics are elected to that honor society, and that's purely based on academics. There's also a new organization since 1988. It's the Gold Foundation Humanism Honor Society. And
you won an award from them.
I did.
Great.
I'm very proud to say I did. And that organization was started in, again, 1988 by Dr. Gold to encourage compassionate care of patients. I think he saw that in the age of scientific discovery and technology, these things were overshadowing the need to provide compassionate care. And so this organization was started. It's the most unique thing about it is that students are elected by their peers to belong to this organization.
That sounds like a great idea.
It's wonderful.
And you got the award. Now the students gave you the award, or the faculty?
For the faculty, it's a student and faculty award. So for faculty, it's a little different, not your peers. But for the students, it's all peer.
Well, congratulations. That's a big deal. That's great.
Thank you very much.
And in terms of the rewards that you might see of people going into the medical arena, what awards do you think are the most important things that we would kind of look at?
Well, board certification is something that people might want to know. That's an advanced level certification. It sort of demonstrates your knowledge in the field, so that's something that you can aspire to. But I think, you know, the reward can be as simple as saving a life. And, you know, treating your patient with compassion and empathy, and taking every day as, you know, a precious gift, and sharing that with your patients.
And is that the motto of the George Washington Medical Center in some way?
Yes, I think it is.
What is the motto? What is there must be an official motto somewhere.
I knew you would ask me that. There is an official motto, it's true.
But this is the perfect time to not remember it. Well, I don't remember the official motto of George Washington's Medical Center anyway, but it seems to me that you are doing a fine job with some of the work that you're doing. So I think this might be a good time to wrap up, unless there was anything else that either of you wanted to add for our viewers in terms of what they should know as they're preparing for their futures.
I would just say, if there are people out there who have an interest in the health profession, it's a wonderful profession. Even in this age of crazy healthcare policy, it is a wonderful career, and one which is extremely rewarding
Personally,
on a daily basis.
Personally, intellectually rewarding.
Absolutely.
And you don't look back at all and regret it at all.
No.
All right. And Henryne, what about you?
And I would say that there is a desperate need for more healthcare professionals today. There are increased demands because of the aging population. Some healthcare workers are retiring. We really need more people to go into this field to help save lives, to provide care to the vulnerable and underserved populations, and we need a competent, diverse healthcare workforce. So I welcome everyone to consider it as a career option.
Well, and I'd like to thank you both for being so articulate and coming on the show today, and also sharing your views about this very important subject. If you would like additional information about the George Washington University Medical Center and the Explore Health Careers Career Explorer, please visit their websites at gwumc.edu and explorehealthcareers.org. Thank you for watching. We will continue to bring you quality discussions about important matters in today's college and university world. Please join me again for another edition of Higher Education Today. I'm Steven Roy Goodman, and you've been watching Higher Education Today.